All right, everyone, we're going to go ahead and get started. More than likely, some other folks will hop in the next couple of minutes, and I will go ahead and let them in, but we don't want to go too far past our start time. So I'm Joe Stenovec, Certified Financial Planner, and with me is MaryAnn Lentini, Clinical Social Worker. I'll let her provide the introduction, but we're going to talk about elder care today. She is a wealth of information. She's been doing this for many years, and I have many conversations with her about this topic, and we've just been talking about it over the years, and it's something we've been wanting to do. And finally, today's the day. So I'm going to let her introduce herself and just take it away. I do have some slides, which I'll pull up as well, and we'll just have a conversation. And please feel free to ask questions. For right now, go ahead and put them into the chat. And then after MaryAnn makes her comments, we will open it up to questions as well. So I can unmute you. You can raise your hand if you would like, and I would be happy to unmute you, and you can ask a question for everybody, or feel free to go ahead and ask the question in the chat. Okay, so MaryAnn, go ahead and introduce yourself. Tell us a little bit about what you do and how you work in the community.
Well, good morning, everyone. And Joe, thank you so much for having me today. I am thrilled to be able to take this opportunity to continue doing education. I have been a social worker in the San Diego area for over 45 years. And 7 years ago, I started my own business as a life care manager. Some people hear the term geriatric care manager. Basically, what we do is we sit down with clients and their loved ones, family members, and we talk about what their life is going to look like from today forward. We advocate for clients. We educate them about community resources. We also basically want to improve quality of life, not just for the client, but for the families, for the caregivers. So over the years, we've noticed that people really need this type of advice. And that's why Joe and I wanted to just have a very informal educational opportunity with people interested. So thank you for taking the time to be with us today.
Thank you, MaryAnn. All right, so we will go through some slides. And again, feel free to ask any questions as we kind of go through all of this. So let's talk a little bit about just common care needs. Okay. So there's everyday versus medical, as you see on the slides, but let's talk a little bit about common care needs.
So basically, what we're seeing is a lot of clients, unfortunately, make decisions under duress. For example, they end up in an emergency room unexpectedly, and they really don't know if they're going to be admitted to the hospital or return home, maybe following a fall. And they don't know what resources are available to help them and to also prevent this from happening again. So as far as supports in the home, you can have things as simple as hiring some home care services. There are agencies out there that have maybe 1 to 2 hour minimums, 4-hour minimums, and you can pretty much hire whatever amount you feel you might need at the time. Unfortunately, this is not covered under most insurance policies. And the difference, and I'm going to accentuate this, between home care and home health, which sometimes people confuse, home health needs to be ordered from a physician. And usually home health includes a visiting nurse, someone to help you with your personal care and hygiene, light housekeeping chores. They can basically provide therapies like physical therapy, occupational therapy. Most patients receive this after a hospital stay. So that's the difference. Home health is covered 100% under Medicare as we speak today. Things could change, and that's the difference. That is what we would consider medical care. To take it a step further, other medical care can include hospice care, palliative care, and that's more towards what we're looking at the end of life versus ongoing care as you need it.
Gotcha. Okay, so and then short-term needs versus long-term needs. I mean,
So basically, let's say you end up in the hospital for a basic surgery, hip replacement, knee replacement. You might need home health for a little while, which will be covered after your hospital stay. And then after that, you might want to hire a little bit of help to assist you while you're recuperating. That's the short term. Long term can include ongoing care, either in the home or what we consider out of home placement. One of my goals is to try to keep the client at home for as long as possible because that's where they're the most satisfied and happiest. That's where a lot of their support systems are. But for those who don't have that type of support system, it's good to start thinking about what is next in my care plan.
Gotcha. Okay. I already have a question, but I'm going to save it for after. All right. So aging in place, medical care, community-based care. Can you talk a little bit about the difference?
Okay, so community-based care is what we would consider any program that's out of your home, whether it is adult daycare programs, like in your local community, you might have a rec center or an adult community center. We have programs in San Diego under the PACE program, which basically allows adults to go to a common area with other seniors where they can get nutrition, they can also get medical care, and increase socialization, which is very, very important to consider as our population ages. We do not want people isolated. Mm-hmm. The next level would be out of home, which we would consider an independent living facility, an assisted living facility, and what we call adult living care facilities, what used to be called board and care homes. And they can range from 6 beds in a home up to 120 beds in a facility. So that's the difference between what we would consider the umbrella of community-based care.
Gotcha. Okay. Pretty broad.
It's very, very broad, including the financial aspect.
Yes.
You are looking at the costs, and when life care managers meet with clients, we want to discuss what's your financial situation, what are you going to be able to afford.
Mm-hmm. Yeah, speaking of, there are some resources out there when it comes to figuring out whether it's projecting cost of care 20 years out when you're doing your long-term financial planning, and also resources to figure out cost of care today. There's a good resource. I'll put it in the chat for you to be able to put in as your zip code. If you Google cost of care, you'll be able to find it, but I'll put the link in the chat. But there are some really excellent resources to figure out how much, a skilled nursing facility is going to cost in your area today, but not only today, but, looking ahead 10, 15, 20 plus years, all sorts of different options. And then also home care, it has some estimates as well. So you can start to do the planning now. And then obviously in terms of funding these for these expenses, there's 2 main approaches. Primarily, it's going to be long-term, and then maybe a third you can put in there, which you kind of like a hybrid, but long-term care insurance or self-funding and looking at your investment assets as a means of paying for these expenses. One of the big kind of risks here is looking at if you have an event where you need assistance earlier in your retirement journey. That's what oftentimes can derail financial plans, is earlier as opposed to end of your life expectancy type of care. And that's where long-term care insurance could be beneficial. There are obviously, you have a lot of experience, I'm sure, with dealing with long-term care insurance claims and the good and bad of that, which is in itself its own webinar.
Yes, I agree. I agree. There's a lot of options out there. And it's very, very wise for people to be well educated. So you're putting the tools in your toolkit for the future, knowing that you're making the best decision. Mm-hmm. Because we want quality here. And with quality, we don't want to feel like we made a mistake early on. And that's why we do these educational seminars, so that you get hands-on experience with someone who's professionally dealt with this, and also not regret those wrong decisions.
Yes, exactly. So legal. So obviously neither one of us are attorneys, but there's a lot of estate planning ramifications to this as well. So some of the just high level very important documents that you should 100% have in place is going to be your advanced care directives, your HIPAA. Basically, you want to talk a little bit about some of these, but power of attorney, durable power of attorney is also an important one as well. They're all a part of an estate plan. But you want to talk about your experience dealing with HIPAA and any?
Sure. I think one of the most important things to consider is using tools to help you fill out paperwork ahead of time. And some of the paperwork that's involved, for example, your advanced directive for healthcare, is to have conversations early on with your loved ones so that they know in the event of an emergency what your choices would be. For example, do you want full care if you're not able to express that to a physician in an emergency room? One of the things I tell my clients to do is have these conversations under more positive atmospheres. For example, using Thanksgiving, when the family is getting together to just talk about with your loved ones, with your seniors, in the event that something happened to you, Mom, what would you want done? So that you get a feel for their end of life choices, and then you get it in writing by filling out the appropriate paperwork. So the paperwork would include advanced directive for healthcare. I encourage people to also get a POLST form, POLST, which is a conversation that you have with your primary care physician so that your primary care physician also knows what choices you want. And you paste that on your refrigerator so that when 911 is called, they know your wishes too. So we are not asking an EMT to do a performance of a medical procedure that you did not want done to yourself. So paperwork is very important, and I know the toolkit is going to list all those, and we're happy to discuss that with you one-on-one if you feel you need that.
Perfect. Let's move on. We're going to try to wrap up these initial comments within about 5 minutes or so. So I figured that we would probably have to breeze through some of these slides, but we starting the conversation. This actually was one of my questions. So you had mentioned Thanksgiving. Are there maybe some triggers even outside of that where you as maybe a son or daughter, if we're talking about our parents, that you may need to not necessarily intervene, but really be a little bit more, for lack of a better word, aggressive about starting that conversation? Are there certain triggers, like maybe there's a fall, or they mention downsizing their home? Are there some good triggers that we can be aware of?
Yeah, I think things to discuss and be aware of. When life care managers meet with clients, for example, I tend to look at the home environment. And the first thing I do is walk around the home and look at things like, is there a pile of mail that is sitting on a table that has not been addressed? Look at their checkbook if they allow you to, and see if anything looks suspicious, like maybe spending too much time buying purchases that they can't afford on the internet, during all these ads on television, things of that nature. Other triggers are, as you mentioned, falls, emergency room visits, lack of healthcare intervention. For example, when was the last time you went to your primary care physician? When was the last time you had your eyes checked, your hearing checked? Because these are triggers in the future. They are now linking, for example, loss of hearing with dementia. So I think there's a lot of things that, for example, life care managers are looking at that we can pass on to family members. One of the other things I do is I look around a client's vehicle and I take pictures of it. And with the client's permission, I send it to the family members and I say, this is a new dent in the car. Did mom or dad mention that they were in an accident? Because this is another trigger. Should they still be driving? So there's a lot of information and there's a lot of things to keep an eye on. And I think as we delve into it, we have to be very tactful about what we bring up to the client because we do not want them on the defensive. We just want to be there to support everyone.
Yeah, I mean, that's like on this slide, balancing independence with support.
Yes.
And not feeling like you're overstepping boundaries because they're just going to put up their guard. Because this can be a very touchy subject because folks really want to, like you said, maintain their independence as long as possible.
Very, very, very important to continue to support that, keeping safety at home in mind. Once we start seeing falls, then we really need to take action because the statistics are scary.
Yeah.
Anyone over 80, for example, that ends up falling may not end up being able to return home. So we really wanted to avoid those situations.
All right, let's see. All right, so as we kind of wrap up our initial, the initial part of this in the conversation, taking the first step. So we have a document that we'll send out after this presentation that we've put together. That's a very good starting point to help getting things organized. Talk to your trusted advisors as well, and such as myself in terms of like financial resources, long-term care, insurance planning. Just take a kind of stress test your plan to look at, in the event you do have some sort of long-term care event, what are the financial ramifications? So that's a conversation that we can have. So I'm going to ask another question that I think is important in the digital age. So nothing else from the slides, but something that I've been discussing with some of my clients is identity theft and protecting your credit. So can you talk a little bit about some of the vulnerabilities online for folks and how they can protect themselves from the internet?
Sure. This is a huge issue right now. I went to a seminar not too long ago to hear the statistics of how many millions of dollars have been taken from seniors in San Diego County alone the past couple of years. And it has almost doubled since last year, which is very, very scary. Simple things like going to a general drugstore and seeing the rack of all the gift certificates that you can purchase. They have actually found scammers that have put another layer over that card, which then reads information about you and falsifies that gift certificate. It's amazing what the technology has allowed scamming and false occurrences to happen. What I recommend is, first of all, you never give personal information to anybody, whether it's a letter that you got that looks like your bank's letterhead, to calling numbers because they want information, to a new scam that's on the ads right now about government subsidies to improve your bathroom upgrades. These are all scams. I mean, imagine our government having the money right now to give you to upgrade your bathroom. That sounds very sketchy. But they make it look so professional because this woman is dressed in a suit with the American flag sitting behind her, and you think it's someone in the government. So my advice is always go to the source. If you get a letter and it claims it's from your bank, do not call the number that's in the letter. Call your bank directly and talk to someone that you might know at your bank.
That's a good idea.
Get the information first. Don't put anything out on a computer. I mean, there's a lot of seniors that are very, very afraid of using AI, for example, and giving information. There's a good reason for it these days.
So save a customer service number for your bank in your phone.
Exactly.
So like Chase Bank, for example, save a specific customer service number that you've had a good experience working with Chase.
Directly.
Save that as your contact.
Yeah.
And anytime you get something that looks like it's from Chase, call Chase.
Call Chase directly. Yeah.
Another one, maybe credit, protecting your credit. So like freezing your credit from
Mhm.
identity theft. And because it's not hard to do through
No.
the main three bureaus. There's TransUnion, Experian, and Equifax. And if
Yes.
you Google credit freeze Experian, credit freeze TransUnion, credit freeze Equifax,
Facts, yeah.
you have to create an online account, but you can freeze and unfreeze your credit.
Yes.
Because I would imagine that seniors are extremely vulnerable to credit identity and
Yes.
identity theft through
Yes.
their credit profile.
Yes. And there's a lot of things that seniors should not be carrying in their purse, for example.
Mm,
We're used to putting everything in our purse and bringing it with us. Leave it all home except for that one card that you might want to charge on. I mean, years ago we were told, do not bring your social security number with you. Don't put anything in your personal possession that someone could snatch from you and now you're lost.
got it. That
So
makes a
yeah,
lot of sense.
yeah. And seniors walking across a parking lot are targets.
Oh, I'm sure.
So be very, very careful.
Um, okay. At this point, feel free to ask any questions. You should be able to, I can unmute you. If you just put in the chat, you should be able to see on your Zoom a spot where you can put in a question into the chat. There's a little chat box, or I'd be happy to unmute if you raise your hand. There is a way as a guest in here to raise your hand, and that will kind of give me the cue to unmute you. I could unmute everybody all at once, but at the same time, that there would be a lot of background noise if we did unmute everybody at the same time. So please ask any questions in the chat, or feel free to have me unmute you to ask any questions. And while we're waiting for anybody to ask anything, so a lot of this is parents and children. So children have to be watching out for their parents in some of these signs.
Yeah.
But what if you don't have any kids?
Very, very good question. And as our population is aging, we are seeing more and more what we call solo elderly, or the new term is senior orphans. These are individuals over 65 who do not have family in the area or support systems. They're basically on their own. And when you live alone, I think what needs to be suggested is to get involved with your community. If you want to remain home and you want to remain connected, there are daycare centers, for example, that you can go to where you can meet people and also learn from them. For example, maybe you want to hire a lawyer to be an advocate for you. Maybe you want to hire a life care manager that can also manage and bring in what I call a village to the isolated client that can help them with paying their bills safely, making sure they get to their doctor appointments, making sure they even see their physicians on a regular basis, making sure that they are nutritionally supported. So many times I go into clients' homes and the freezer is filled with frozen dinners, which is loaded with sodium and not nutritious all the time. We have so many resources available for seniors who are living alone. It's important to get that village to surround them. So great question. That's what we do with a lot of seniors who are alone, is to connect them with good support systems.
Got it. Okay. All right. That's helpful. All right. Here's a question. Let's see. If you have a parent who is showing signs of dementia, how do you blend their independence with protecting them? Are there specific, I think that says tools, there's a little, for filtering the phone calls or filtering mail?
Oh, very good question. Not too long ago, someone was telling me to be very, very careful about what we actually get in the mail. And for seniors, this is a challenge because they're used to everything on paper. But for example, financial statements that might come in the mail really should be stopped. It should be on your computer so that you can access all that information privately, rather than somebody ransacking your mailbox, which we know happens.
Mhm.
I even tell clients, do not have travel brochures coming to your home, because people who ransack, for example, your mailbox can see that, wow, maybe this person has some finances because they're traveling.
Mhm.
So that's one thing that you can do. For dementia clients, I think it's very important to have a discussion with them as they're going through their mental loss to see what they're willing to do with you as a son or a daughter. Do you want to start getting involved with paying their bills? Do you want to start getting involved with handling their mail? Because the more eyes and ears on what's going on in the situation, the better. So,
Okay.
yeah, I mean, the conversation in a non-threatening way is the best way to approach this sooner than later, while they can still give you the answers that you want to hear.
Would you say, is there a point where you would want to bring in, not necessarily like an intervention per se, but at you a point where you should start to consider bringing in a third party?
So it really depends on the client situation. If family is in the area
Mm-hmm.
and they have the time to get involved, that's one thing. But so many of my family members of clients are overwhelmed as it is. They're still working, they're still raising their own children. And the thought of now taking care of mom and dad and all that is
Mm-hmm.
involved might be overwhelming. So we could start looking at what we would consider hiring life care managers, or even considering conservatorship,
Mm-hmm.
which is a whole nother level, but it relieves the family members of this huge burden
Mm-hmm.
so that they can remain a daughter and a son
Mm-hmm.
instead of another full-time caregiver, because there's so much involved.
Yeah.
But start having the conversation now while they're still able to tell you what they want and what
Yeah.
they don't want.
Okay. All right. Yes, I'll pull up the URL and put it in the chat in here in just a second. Oh yeah, through the U.S. Post Office, you can sign up for daily scans of the mail when it arrives at a person's home. That's helped tremendously in supporting MaryAnn's mother. Also, go through the mail periodically and physically send back forms with the directive to remove from mailing. That's a good tip.
That's a very good
And
tip.
even the scanning, yeah, you can, a son or daughter or whoever's assisting can also be on those alerts as well. So
Yes.
it's not just the homeowner.
Yes,
that's
exactly.
getting the
It's a
alerts.
great tip. That's
Yeah,
a
that's
great
great.
tip. There's a lot of good resources out there. I don't want to say just Google, but I would say start talking to professionals that can guide you through ways to protect your loved ones.
Okay. Support resources available for caregiving spouse. I've seen several times that the caregiver is also in need of emotional and health support, even though, yeah, that's a really good point.
That's a great point, Matthew. We are really fortunate in the San Diego area and in other counties and areas of the United States with caregiver support groups. So many now are online. Most of them occur during the day, but there are also some support groups that are in the evening where you can go on Zoom and at least start listening to other people's situations so that you don't feel like you're alone in this. You could say to yourself, oh my gosh, that's just what I went through with my mom 2 weeks ago.
Yeah.
And it normalizes what you're starting to feel, because this can be overwhelming. Other resources for caregiving is to get in some respite. Hire some help if you financially can to give you some time off, just to go to a movie, just to take a break and have someone stay with your loved one if they can't be left alone.
Yeah, that is they in and of itself. You need a support group for the person that is a caregiver, because it can be obviously very overwhelming and a full-time job, or at least a part-time job. And sometimes you also have a part-time or a full-time job already. What other questions Fire away, folks. This is a great opportunity to ask MaryAnn any question that's on your mind. She's an incredible wealth of information. I'm going to stop sharing my screen so that I can pull up the website that you can run the cost of care calculations for yourself. Let's see here while we're waiting for any other questions to come in.
The cost of care has really gone up since, for example, in San Diego, since COVID, caregivers are not as abundant as they used to be. So with that, home care companies are charging a lot more for caregivers. Plus they're having to cover for their workman's compensation. And now with the rise of gas prices, they may be having to also subsidize that for their home care people. I mean, average in San Diego, you're looking at a minimum of $38 to $40 an hour for a home care caregiver. And that can go up to as much as I've seen $60 an hour, depending on the client's level of care. For example, if they just need somebody to do meal prep versus a client that's bedbound, that can also be charged based on how much care the client actually needs. Now, a family caregiver is getting nothing for this in most cases. So all of a sudden to have to pay that kind of money can be very, very hard on loved ones.
Got it.
Yeah.
Tips for having a discussion with a family member who is unwilling to talk about the subject.
Okay. Very, very good question. I honestly feel that the best thing to do is find out why the client is unwilling. Is it because they're afraid to give up their independence? Has there been talk of, for example, if things don't continue to go well, we may have to start looking at out-of-home placement, which the client may not want to hear yet. Independence is very, very important for our senior community. They really want to hold on to everything. And as we age, we feel like we're already losing our independence.
Mm-hmm.
You know, in our 50s and 60s, we're still up and going and able to walk to whatever we need. By 70s, 80s, that drops off significantly. So the client is already feeling like they've lost their independence. So minimal steps at a time is what I advise. And you can do something as simple as, would you mind if we had somebody to come in and just take you to the doctor's office for a doctor's visit because I'm not able to take work time off anymore? That might warm a client up to another person getting involved with their care that they can start building a rapport with, as simple as just driving them to the doctor's office and then having somebody else hear what the doctor is saying to the client with the client's permission. So there's more than one set of ears listening to what the doctor just said, because they're talking a mile a minute because they have 20 minutes with you and half of it's going over your head.
That's a good way to kind of ease into it again.
Yeah. And I can give other tips one-on-one. We've all been through this. I've been through it with my mom, and it took a while for her to realize that she needed some assistance at home just to stay there safely.
And she's a tough cookie. She lives on the East Coast.
She lives on the East Coast. She just turned 95. God bless her. But boy, she was stubborn for a while there. It took a little doing, but now she realizes the benefit, and she loves the woman that comes in to help her. Yeah.
Any other questions? I was going to ask too about, and then I guess we can start to wrap up unless there are any other questions. But the placement agencies, like that has kind of exploded. There seems to be a lot of placement agencies.
Yeah.
And how do you kind of decipher the good from the bad? It might be kind of a loaded question, but how do you decipher the good from the bad? Because like turnover, it seems to me it would probably be a challenge with a caregiver if you're going through a placement agency.
Okay. So By placement agency, we have a couple of different placement agencies that help family members locate out of the home placement for assisted living, for memory care facilities. They're all over San Diego. Some of them do belong to organizations. I would highly recommend contacting someone who has worked with the placement agency directly before talking to them. You know, when your mom was placed, who did you use, for example, and were they good? Did they do a good evaluation of your situation and then sent you to see facilities and went along with you to visit the facilities and tour them and answered your questions? When you're hiring home care, for example, how do you pick and choose home care companies? So there's so many in, for example, San Diego County. We've got hundreds of home care companies. How do you pick a good one? Again, do you know someone who used one that was reputable and helpful? Medicare actually has a site that you can check to see if the home care company had any issues brought to their attention, along with out-of-home facilities. Were they inspected lately? And they'll actually give you the written report and what was done about the negative comments that were found by someone who went out to see.
Interesting.
Yeah. I don't want to recommend using anything that's out there that anyone else can comment on, like Yelp.
Oh, interesting.
Because we don't know who the Yelp people are. It could be friends of a facility that just put in a good report on Yelp. So that's one thing I do not encourage. And again, you've got social workers in the community that can help you because they might work in hospitals that deal with this situation every day as they discharge patients. You've got life care managers that can also tell you, I know of facilities in your area that have good reputations that my clients have been very helpful with.
Got it. Okay, that's good. Thank you.
Sure, sure.
Okay, advanced care. I have an advanced care directive I did a dozen years ago, though, through LegalZoom. Okay. Oh, as Joe knows, I have not updated this with my attorney. I recall my mother doing this with a form from Kaiser. Are there any suggestions for updating? Can it be done online? Would you recommend doing it online?
Okay. Good question. I advise clients who have done an advanced care directive to review it every 2 to 3 years. You forget how long we sometimes do paperwork. I had a case not too long ago where the advanced directive had her divorced husband as her representing agent. And now she does not want her divorced husband to be on her advanced directive for healthcare. So review them every 2 to 3 years. I would say for an advanced directive for healthcare, if you did it through your healthcare provider, like while you were in the hospital, because most patients now need one, you should also have one done for yourself that's more up to date, not for just the hospital stay. Make sure your primary care physician has a copy of it so they know what you want. You can do it online, and that's okay. But if you're going to do it that way, make sure there's 2 witnesses and or have it notarized.
So I guess it's better than nothing.
Right.
But is it the ideal scenario? Maybe not. But I would say it's a step in the right direction.
Yeah.
Anything else that I didn't ask or was brought up? Anything else you want to add before we wrap up?
The only thing I can say is, first of all, again, thank you for being here. We're probably speaking to the choir. It's those individuals that don't seek assistance that end up making decisions under duress And when we are stressed, we don't always make the best decisions for ourselves or for others. So pre-planning, taking a good look at the slides that Joe has put together for you is an excellent first start. And I speak for myself and for Joe. We are here to assist. We want to hear that you have questions step by step as you go through this process, because we want to make sure that you do it right.
Yeah. Absolutely. Well, I appreciate that. Thank you. Well, MaryAnn, I really appreciate you coming to the office to do this. It's been very, very informative and extremely helpful.
My
I know
pleasure.
this is a very important topic for us to be bringing up. And heck, you could just send the slides to a family member and just say, hey, listen to this presentation. It's just like a little nudge, that
Sure.
may give you a little window of opportunity to bring this up with a family member. So do something, as little as that might be all that needs to happen.
It's a good start. It's a good start. And we are available to help.
All right, so we'll send some follow-up resources, questionnaire. There's an AARP guide, which we didn't even talk about, but there's a wonderful guide that kind of walks through some of this and also has a series of questions in there as well. But we really appreciate your time and hopping on this webinar with us. And MaryAnn, thank you again for yours and your wealth of information. It was a pleasure having you all on the Zoom, and we'll talk to you soon. Take care.